So the transport team, we work between facilities. So we will get a call from critical access hospitals out in New Mexico and around our state who don't have pediatric services. And those hospitals may be in Ruidoso, Alamogordo, who may not have a pediatric floor, will call us if they get any pediatric patients in their ER that needs oxygen, needs higher level of care, or even an admission. So if they don't have pediatric services, then we will bring them over here to Las Cruces, where we have a pediatric ICU and a NICU. We have to leave within 15 minutes of getting a call. We head out to whatever facility. I get report from the facility where we're going to pick up the kid. Our respiratory therapist is calling our crew to bring the ambulance around so we can load. I run to pharmacy and I get another big bag of just all the medications. We have all the equipment that we need. There are some times that we'll get somewhere and they don't have small enough tubes or small enough catheters or anything that needs to treat that baby. And so just having the equipment that fits those babies is important so that we can bring them safely and that they can get the treatment that they need. Then we'll go to that floor, we'll assess the baby and just make sure that they're stable. If the baby's stable, we call our provider here at Memorial and give them an update. We get any orders that they need us to get to transport them. And then once we get all the orders, we can implement, whether it be IV fluids, start an IV, do some more blood work, start oxygen or do higher level of oxygen, because sometimes they may be on oxygen. We need to do high flow or we need to intubate or do some other procedure before we leave. Load them up in our ambulance. It's an ambulance service that we use, that we partner with, and they have a dedicated truck that stays here at Memorial where we can just jump on. We have all of our supplies and we take that with us and we go to that other hospital. Is higher level care than just a regular EMS truck, because we can provide more services than just IV and IV fluids. On the way home, the EMT also will join us, only because if we end up in a code situation with a child, we have an EMT, RT, and an RN to do all of our roles, and we will basically ask the EMT to join in helping us. We'll assess, we'll do a full assessment of the patient, make sure that there's nothing else that we need to do. We call our ICU doctor and ask them, give them a rundown of their assessment, and then they give us any orders that we need to do before we come back. We do everything together, care of the parent and for the care of the patient. It's not just like a solo job like we would have at the bedside where the nurse does a lot of things by themselves. It's a team effort, and it's a family-centered care where we're bringing the parents, we're bringing the kid, and we just want to have a safe transport for them. We all came into this job knowing how to specifically take care of neonatals or pediatric patients. It is rewarding because you do have that one-on-one patient care, but also it's rewarding because of the teamwork that we have, the ability to work at an ICU level, but also work with families one-on-one. So like in the most stressful parts of any person's life or family's life, transporting their kid from one city to another, we can be there to reassure them, to be a part of that process where hopefully they feel comfortable with us, they feel like they have the best care, but also just having a team that is coherent and works together really, really well. That's why I work here.